I would say that one of the problems we have in epilepsy is that if you come to me with a seizure, I give you a pill to take, and then you say to me, well, will this work? And I tell the patient, you'll tell me if it works. That's the equivalent of somebody coming with heart disease, and I say, take this pill, and if you don't have a heart attack, I guess it's worked. It's very unsatisfying. We don't even have something like blood pressure or blood glucose to monitor along the way. There's really no good surrogate. Are there any prognostic biomarkers, Trevor, or diagnostic biomarkers that you tend to use or think might be promising at some point in the future that might help guide our advice to our patients and guide your choice of therapy?
Yeah, I think we've discussed a couple of those already. I think some of them also are biomarkers that come with diagnostic testing. Just as an example, we were talking about genetic mutations. One genetic mutation, SEN2A, is specifically sensitive to treatment with phenytoin, which is a drug we never think of anymore, especially in pediatrics. So a lot of these additional tests are making us look back and think about specifically focused treatments that are not currently part of our usual thinking.
And the old EEG is actually not a bad biomarker, and the MRI, right?
Yeah, I can comment on that. The MRI has advanced significantly over the last several decades, and for a patient particularly who is not responding to medications, I think it is, and if the initial MRI is unrevealing, getting a epilepsy protocol 3 Tesla MRI can be instrumental with fine cuts through the hippocampi to improving your diagnostic accuracy. What's happened in very recent time is the advent of higher field MRI. 7T MRI is now approved by the FDA for clinical use, and centers are starting to use that in patients that have non-diagnostic 3 Tesla MRIs. That I think will lead to improvement in finding focal lesions. And we know if we can find them, that the treatment options surgically are much improved. And then there are other types of MRI and imaging that are being studied. We're applying machine learning to these different modalities, and I'm hopeful that in the coming years we'll have a lot more, many more biomarkers at our disposal.
Eric, did you want to add any comments to that? Or?
Just one peripherally to that area is, in some of the patients, the genetic testing again, or the markers that we have, may transform a situation where you have an unknown etiology that seems to be focal, and we're trying to find that microscopic heterotopia after surgery. And we may be able to diagnose that epileptic brain as a genetic etiology, which makes it less attractive for a surgery regarding outcome. So it is an area that we need to explore more, and at least it allows you to select the best possible candidates for surgery.